Hi everyone, our subject today is floppy infant in summary. Essential of diagnosis, clinical term to describe neonate with abnormal motor tone. Abnormal motor tone in infancy is reflected in decreased motor activity, both voluntary and in response to stimulation. Abnormal deglutition, cough, and defecation, chronic assumption of a frog leg or other abnormal body position, a delay in motor milestone. Physical examination show abnormal neck and back muscle strength during ventral suspension, infant supported supine with the hand under the chest, and excessive head lag. Older infants come to medical attention because of poor endurance and delays in walking and climbing. Benign hypotonia is a term used to describe a weak, otherwise normal child with no obvious cause for weakness. It is a diagnosis of exclusion. As tests of muscle and nerve function improve, this diagnosis is likely to disappear altogether. Diagnosis: arterial ischemic stroke. Age of onset, any age. In children, most commonly in neonate. Pattern of deficit, acute onset of unilateral face, arm, or face, arm, leg weakness with or without cortical sign. Differentiating feature, acute onset and unilateral. Cerebral palsy, pre or perinatal insult, present at birth, usually noted by age of 2 years. Different form, spastic versus dyskinetic versus ataxic, and it is non-progressive. Prematurity and kernicterus. Spinal muscle atrophy depend on type. Type 1 is most common and present in infancy. Diffuse symmetric weakness, proximal more than distal. Tongue fasciculation, minimal to absent deep tender reflex. Die from respiratory insufficiency. Neonatal brachial plexopathy in neonate, unilateral arm weakness, shoulder dystocia. Congenital myasthenic disorder from birth or early childhood, fatigable weakness mainly affecting the ocular and bulbar muscle, genetic defect. Transient neonatal myasthenia gravis in neonate, generalized weakness and hypotonia at birth with the intact deep tender reflex. Mother with myasthenia gravis, eye involvement less common. Infantile botulism, 2 months to 8 months of age. Constipation, for progressive hypotonia and weakness, may be descending with or without a cranial nerve dysfunction, including impaired pupillary response. Honey, construction site, candid food. Myotonic dystrophy depend on type. Congenital, which is neonatal, versus childhood versus classic, which is an adult type. Skeletal and respiratory muscle weakness, myotonia, trinucleotide repeat expansion, autosomal dominant, cataract, cardiac arrhythmia.